You never think something like this could happen to you. I knew I was at risk, but I didn't think heart problems would happen to me. When it happens to you, you're angry. Your life has been put on hold. You think, is this it? Am I going to die?
In 2003, 660,000 open heart surgery procedures were performed. Nearly 1.5 million cardiac catheterizations were performed. For 20 years, Martin Memorial battled for the right to provide its patients with open heart surgery. Finally, in 2004, Martin Memorial earned that right and began construction on a cardiac care center. In August 2006, Martin Memorial officially opened the Frances Langford Heart Center, named after the late singer-actress who donated $5 million to Martin Memorial.
Well, our community has needed an open heart surgery and angioplasty program for more than 20 years. We've had adequate volumes to do a good job with open heart for that period of time, and unfortunately the services have not been available here locally for that entire period of time. And I can tell you there have been many days when we've had to transfer 6, 7, sometimes as many as 10 patients as far away as Miami to receive life-saving angioplasty and open heart surgery.
Martin Memorial is teaming with the esteemed Ocala Heart Institute, which has helped Monroe Regional Medical Center become one of the top 100 heart programs in the country for 7 consecutive years. Martin Memorial is also working in partnership with highly skilled Treasure Coast cardiologists from Cardiology Associates of Stewart, Florida Heart Center, and Stewart Cardiology Group to continue providing outstanding care.
We've developed a partnership with the Ocala Heart Institute for our surgery here, and we just believe that that was one of the best things that we could have done for our community. The Ocala Heart Institute surgeons and their program, their discipline and their program is really one of the best in the country, if not the best in the country. The mortality rates, the length of time patients are in surgery, the length of time they're in intensive care, the length of time they're on the heart-lung machines, is all some of the best numbers of any program in the country. We're so pleased that we have this partnership with Ocala Heart Institute.
The Frances Langford Heart Center exemplifies world-class health care with state-of-the-art technology, including sophisticated machinery for interventional procedures and operating rooms designed to maximize efficiency during open heart surgery.
Angioplasty is basically the same as we do for our diagnostic cath. We're going to put a catheter up through the leg into the coronaries that surround the heart. But with angioplasty, we're actually able to feed a wire into the artery that needs to be fixed. We put the catheter into the artery also, and there's a balloon with a stent in it. And the balloon, we can inflate the balloon. The stent is then applied to the vessel wall, and it keeps that vessel open. So the blockage that they had before is now gone.
Martin Memorial renovated one of its 2 cardiac cath labs, installing cutting-edge technology that will reduce turnaround from diagnosis to intervention. Images that in the past were recorded onto film can now be sent directly to an image archive computer. Physicians or staff can then access these images quickly. In cases where interventional heart care is not the solution, patients must come for open heart surgery. Surgeons with the Ocala Heart Institute have performed more than 22,000 procedures and bring standardized methods that have led to outstanding outcomes.
When I did my first open heart surgery in London with a very wise physician who told me at the time, when he was helping me, learn the system, was that a good open heart surgery should be like a ballet. Everything's choreographed just like it would be in a ballet, so that you don't miss steps, you don't cut corners. Everything is standardized so that you get the same predictable outcome every time. And I always remembered that. So when I looked at the Ocala Heart Institute and their philosophy of standardization, it's pretty much the same thing. They do everything the same way every single time, so that everybody on the team knows their role, knows what their contribution to that team is, and again, you get the same predictable patient outcome and nothing is missed. You go from point A to point Z and every step in between.
When patients finish surgery, they recover in our high-tech cardiovascular intensive care unit.
We have a highly trained, compassionate staff whose mission is to provide the very best care to the patients and their families from the time the patient enters our doors until the time they walk out ready to go home.
Our sophisticated monitoring technology ensures our patients will receive the best possible care immediately after surgery. And our coordinated approach to total heart care ensures our patients have all the resources to recover and return to a normal lifestyle. At Martin Memorial, caring for our patients is a team effort that comes straight from the heart.
We're so pleased to open the Frances Langford Heart Center here in Stuart, Florida, where we're going to offer world-class heart care for our community.
The Frances Langford Heart Center at Martin Memorial. Hope is a heartbeat away.